Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. I would like to present my study with the title Mixed Method Implementation of the Congenital Hypothyroidism or GH Screening Program in Indonesia as an effort to prevent statting. This is the author identity. For the first author is me. My name is Septi Wardani. I'm focusing in Department of Pediatric Nursing in Universitas Muhammadiyah Magelang, and my research focus in stunting and management of children illness. And the second author is Dwi Sulistyono. He's from Department of Pediatric of Nursing at Universitas Muhammadiyah Magelang, and then her research focus in management of children illness. And then third author is Dr. Estiv Adrian Esteve. He is from Philippine Women's University. Why we doing the study? Start from development target from Indonesian government and SDGs. So the Indonesian government target is to reduce stunting by 16% on 2025, and then SDGs target to eradicate poverty, hunger, and improve health status on 2030. And then from both target can be a realization of the main target of the development plan. And the next about stunting, from etiology of stunting in Indonesia, because low consumption of nutrition food among pregnant women and children, and then children not receiving exclusive breastfeeding, and then the children not receiving maximal immunization. From that can be cause the impact of stunting. The first one about susceptibility to illness, imbalanced body function, reduced cognitive abilities, and then the impact of stunting can be resulting in a loss of gross domestic product or GDP of up to 11%, and as adult reduction in income of up to 20% for economic loss. The next about the relationship between hypothyroidism and stunting, and previously some study from other author regarding Hastuti on 2023. From the result from their study is maternal hypothyroidism correlate with very short stature and stunting in children. And then regarding Abak et al. On 2023, from their result study, children with thyroid disorder such as goiter are strongly associated with stunting. And then regarding Kartini on 2024, from their study, the result is of 52 children with stunting, 30% had thyroid disorder. And the next, from the relationship between hypothyroidism and stunting can be contribute. So hypothyroidism contribute to and is a risk factor for stunting. It is from development target and stunting, and then the relationship between hypothyroidism and stunting can be. It is very important to evaluate the implementation of GH screening so that the possibility of stunting due to hypothyroidism can be prevented. And this is the method. We use a mixed method study with a sequential exploratory model with two research stage, quantitative stage and qualitative. In the quantitative stage, we use a cross-sectional study to examine how GH screening implementation relate to the number of newborn, and then newborn screen, and then the number of newborn with hypothyroidism and their management. And then for qualitative stage, qualitative data were collect through focus group discussion. Respondents were officer directly managing the implementation of GH screening, but both in hospital and community health center, and were select using purposive sampling. And the FGD guide and then observation and documentation studies were used in the qualitative data collection. And then for inclusion criteria for the study include all newborn GH screening data from January to April 2025, as well as officer implementing GH screening. And then for the result from my study, from for first result about number of newborn, the first result concern the number of newborn. The number of newborn between January and April 2025 at the three health services was 917, and all had undergone hypothyroidism screening. And this means that 100% of newborn underwent GH screening. The second result from my study about timing of congenital hypothyroidism screening. The data in the table show the infant age at the time blood sample were taken for GH screening. Of the 916 infant, 59.59% had GH screening sample taken at less than 48 hours, 13.9% at 48 to 72 hours, and then 26.94% at more than 72 hours. And then the research result showed that the majority of GH screening sample were taken within 48 hours, as healthy babies are discharged within 24 hours of birth. Furthermore, this relates to BPJS policy in Indonesia is BPJS policy, which only cover 24 hours for newborn inpatient care. This align with the respondent statement on the slide. So you can reading the slide for respondent's statement. The result about presentation of newborn with hypothyroidism. The data in the table show newborn suffering from hypothyroidism in the three healthcare facilities. Of all newborn, only 0.10% suffer from hypothyroidism. And then for next result, our study about management of hypothyroidism. The study found that both hospital did not receive information or report on the management of infant with hypothyroidism. This is reflected in the respondent statement on the slide. You can maybe you can read my slide about a statement of my respondent. Meanwhile, the community health center or puskesmas found that during the 2 years of the GH screening program implementation, no newborn test positive for hypothyroidism. And then the study also found that the timing of GH screening result was approximately 2 to 3 months. The conclusion from my study, so the congenital hypothyroidism screening program in Indonesia has been running well, as shown by the achievement of 100% screening coverage. However, in terms of quality, the program is still not optimal. The timing of GH screening has not been consistent conducted within the recommended for 48 to 72 hours. The screening laboratories are only available in a central hospital, and the management of hypothyroidism is also not ideal, since screening results are received only after 2 until 3 months. This delay prevents babies with hypothyroidism from receiving timely treatment within the first 2 weeks of life. This limitation in congenital hypothyroidism screening implementation in Indonesia highlight the need for government action to strengthen infrastructure and resources so that GH screening can be conducted in all regions. That's all my presentation for my study. Thank you for the opportunity and your attention. Good morning. Assalamualaikum warahmatullahi wabarakatuh.